So welcome to today's webinar. It's using Telin for panel screening and prevention. What we are going to cover today, a little bit about helping users help themselves, a little reminder there. Talk about the release notes and what is on the top website. And then we will get going with our guest panelist today, Elizabeth Winans from the Calgary West Central Primary Care Network. And she will be showing us some information about their approach to panel identification and management at the clinic she's working at. Look at the poem template, how she is using the analyzer and query functionality within Telin at the clinic she's working in, and then look at her approach to a registry for metabolic syndrome at that clinic. Just wanted to point out, I was looking at the Telin MediPlan release notes and some information that is relevant to the audience online is that as late as July, they did some work that impacts the poem template so that it should be fitting in the windows better. They also did some fixing with the FIT test for colorectal cancer screening, populating the poem template. And they also did another fix on the poem not properly saving the Framingham score. Another point I wanted to mention, whenever I do the webinars, I also ask people that when you are in a clinic and working with users, and find out if they've ever used the help functionality within their Telin EMR, show them how to get to it. Telin has a very good knowledge base, which is quite helpful for a user to get information about Telin if they don't have immediate access to help within the clinic. So we're going to go to our panelist, and I'll introduce Elizabeth Winans. Elizabeth is the collaborative team assistant. She's currently working in the 4th Street Clinic in Calgary, which is part of the Calgary West Central Primary Care Network. And Elizabeth has had a very effective approach in this clinic for her panel identification processes. And she's very generously offered her time today to share with us the approach that they're taking at that clinic. And she will be able to show us how she's using the analyzer and the query functionality to get results in her clinic. So we're going to move over to you, Elizabeth. As we get going, we're a small group today. Do you want to offer a little bit of background?
Sure. Okay. So hi, everyone. I'm Elizabeth. I guess that we've been working with TOP in the last few months at the clinic here to develop a panel and have a better understanding of what our panel is. And I was just going to go over sort of what our strategy has been for that. I've been working just for the last few months actually at the Calgary West Central Primary Care Network, but a big part of my role with working at the 4th Street Clinic has been ensuring that the panel's been managed and developing some diagnostic registries of different conditions with the paneled patients in particular. So I've been working with Telin a lot on and developing different reports for that.
Thanks, Elizabeth.
So should I?
Yeah, go ahead and start showing us your approach to panel identification.
All right, I will. So basically we have a few different strategies. We've decided to go the approach of adding patients to our panel sort of as they go, as they come in, activating patients. And so I'll show you a few of the ways that we've been doing that. So if you click on the registration icon in a patient, I have a test patient here, you can see one of the main ways that we've been confirming that a patient is a part of our panel is by clicking this button here, which, as you see when you click it, it shows the most recent date that you've confirmed. And so because this is a function in Telin that I know some staff members at a may have used at a different time while they had Telin. They might have confirmed with the family doctor a long time ago. This date is really important because you're able to search how recently it was confirmed, and so we've been making sure that all patients that have been confirmed using this in the last 3 years are a part of our panel. And we also, if you look down here, this is a really important function in Telin that allows you to change the type of the patient. And so in our clinic, we have a doctor that performs vasectomies. He has that specialization on the side. So if you click this button, you can see that you're able to designate this patient as a vasectomy patient if that's their function. And then also, all other patients are office patients. So this is sort of a secondary check and balance to make sure that the patient is part of our panel. And then the final check is if you see, we have the number of the physician, and then we have a separate window area where you can have the doctor's name. And so those are sort of the three main checks that we use every time a patient comes into the clinic. All of the reception staff, when they check in a patient, and even when possible, when they're on the phone with a patient, we check that their doctor, that is their primary doctor, and we do those three checks. And then additionally, obviously, we make sure that the patient isn't deceased and isn't inactive. So that has been our strategy.
Okay, thanks, Elizabeth. And I want to point out, too, that the chart type field is customizable at the clinic level. So if a clinic has a number of specialized services, like vasectomy care, such as maternity care or other specialty clinic services, they can customize that type field in Telin for use at the clinic. Great, thanks. So let's go on with this test patient. Can you show us the poem for a test patient?
Absolutely. So I'll just save that. And so I don't know if everyone here is familiar with Telin, but the poem icon is right there. And our clinic actually just received an update last week with Telin, and so this is the most updated version of the poem. And like Barbara mentioned earlier, now the fit test is populating, which is something that we were having an issue with, and you can see that the window is a little bit different than it was in other versions.
Okay. And
so
go ahead, Elizabeth.
Oh, I was just going to say, you can see that all of this information populates here. The reason that, of course, there's no information here is this test patient hasn't received any labs recently, but you can scroll down and see all of the different labs that would come in and populate this information.
And can you do us a favor and just click on the Framingham icon?
Absolutely. Yeah, so that works automatically.
That's great.
If you continue, that'll populate in that area there.
Okay, and it'll be saved.
Mm-hmm.
Okay, great.
Okay, so are there any questions about either the poem or any sort of our particular strategy to panel management so far? Okay. So Barbara, was there more that you wanted me to show here, or can I move on to how to save the panel queries?
Just a question about the poem template, because I know it's not used exactly the same in every clinic, but which roles in your clinic are using the poem template to enter information?
It's typically the doctors and the physician assistant that use the poem template, and occasionally some of our allied health staff, so pharmacist will use the poem as well.
Okay, that's good to know. All right, thanks, Elizabeth.
Okay. So then I guess I'll go on to explain that one of the main functions that I've been having is before I began working at the clinic here, but I've been working to develop reports that show basically a list of all of the panel patients. So I'll just go through how I've done that. So I've been finding that one of the easiest ways to develop a list and a report is by using the analyzer tool. And so I'll show you, you just go to data, and then it's right down here, analyzer. And so this is the analyzer window. And in order to select, to run a search for the patient panel, I'll show you, you need to select the table at the bottom here, patient, and then search. And what you're actually able to do is save and load a query, which is, I'll show you how to do, and that's quite helpful. And so, for example, this is one of the doctors here, Dr. Harvey. So this is the saved query that I have for how to develop a list of Dr. Harvey's current panel. And so in a moment, I'm just going to go through and show you how to get this information there and saved, but that's sort of a bit of a preview of how that can work. So to start at the beginning, if I hadn't developed that query yet, you'd start by going to the analyzer, selecting patients, and then selecting search. And you can see that the query editor here is blank so far, but the very first thing that you do is scroll down here to family doctor. And just so that you know, once patient is selected, that'll be the automatic table that I'll generate here. But if you ever accidentally clicked this and ended up at all tables, you can scroll down to patients. Here. And you'll have an alphabetical list then of all of the different searchable elements within patients. So just a little tip there. Okay, so we have our family doctor selected, and I usually just say contains, and for Dr. Harvey, for example, I can just do Harv. There's just a little bit of information there. And so then once you have that, you click Add Line, and an and will automatically pop up, and then you can go to the second field. And so what I explained a little bit with the test patient, and I wonder if it won't let me do that. What I explained with the test patient earlier is that one of our checks and balances is making sure that a family doctor name matches the physician code. So I'll just go into physician, if I scroll down, and this is the physician number. And so I want to make sure that in addition to having the family Dr. Harvey, it is also equal to his number 01. So that's one of our checks and balances. And so then the next one, and this is probably something that anyone using Telin and doing a panel, no matter what your panel strategy is, would want to include, is to make sure that the patient is not deceased. So actually, once this is selected, I can just hit the D key, and it'll pop up immediately in this alphabetized list. So I have deceased, and I want deceased does not contain true. So I'll just switch that to true. So that's probably something that everyone will want to include, no matter what your panel strategy is. And so then again, similarly, I can just press the I key. Oh, it's not working. Sorry. And jump to inactive, and we'll do the same thing. So inactive does not contain true. And then I'll add a line again. And this is where we include the family doctor confirmed, that little checkbox that we've been using. So that's this here. And this is interesting because it lets you search by the year. And so what we've been doing in our clinic is family doctor confirmed is greater than, and then you enter in the date. So I've been doing January the 1st, 2011. but you have the opportunity to play around with that depending on what your strategy is. And so, for example, I know that if you decided 3 months ago, for example, to start your panel identification process, you may want this value to be 3 months ago, or you could do it for 5 years. So that's definitely something that you could play around with. Okay, and then there's one more, and that is the chart type. And like Barbara was saying, that is customizable. So you can use that. You could call it paneled patients. There are lots of things that you could do with the chart type window, or designate whether or not a specialty it's part of a doctor's specialty. So then I'll do chart type contains, and our value that we use is office. Okay, so now we have this query all set, and I can press save. I'll save it as Dr. Harvey panel, and I can press save. And now this is entirely saved. And so when I press query, you can look here at number of patients in set. This is my number that we're at right now in terms of how many people are part of Dr. Harvey's current panel. And so if I want to access that information, I can go through the report, and I'll explain how to use the reporting function a little bit later if we have time. But we have this number here, and that's that panel, and anytime we wanted to go and locate that, you could just select the table patient, search, load, and then there we have that Dr. Harvey panel, and we have all of that saved. So are there any questions about how to use this search function relating to the paneled patients? No? Okay. So Barbara, should I go on to using a diagnostic query, or was there something else that you wanted me to pause here for?
No, I think at this point, going on to the diagnostic query would be a good next step, because now you're going to base it on his panel.
Yeah. Okay, yeah. So I can press query or cancel here. So one of the things that I've been doing in this clinic is looking at developing queries for patients of a particular diagnosis, and then finding out who of our panel patients have that diagnosis. And so you could do that with a variety of different diagnoses, but one of the things that we've been working at our clinic is patients with metabolic syndrome in particular, and we really want that list so that we can make sure that all patients with metabolic syndrome are contacted and are offered the opportunity to see one of our allied health members, so the chronic disease nurse specifically, to be able to go over some dietary education with them. So that's been really important, but we want to make sure that the patients that we're contacting are a part of our panel and actually active patients. So I'll just show you how I developed that query. So this table, I choose diagnosis, so that searches information from the diagnosis part of Telin, and I'll press search. And so what we've been doing you see that all tables are selected, and I'll just scroll down to diagnosis. And the first step that I use is to select the ICD code. And so if you go into, maybe I'll show you this. So I'll just press cancel here and minimize that, and I'll show you that in the diagnosis section of the test patient, you can see that this is the ICD code for each of the diagnosis. And this patient, that's spelled incorrectly, so that's something to watch for, that often when you put in diagnosis codes, you really want to make sure that there's some sort of consistency with what the code is, or it's not going to be searchable, right? But you can see that there is an ICD code for each of these conditions, but it's also possible to enter a diagnosis without an ICD code, and we'll be trying to pull from both of those when we make our search. So if you look This information that's entered in this list here is called, when you search using the analyzer, it is the problem. So we'll draw on this when we develop our query. Okay, so let's go back here. We have diagnoses selected, and I'll press search. Go back to the diagnosis area. And the first thing, as I said, is we'll do the ICD code. So the ICD code that I have for the metabolic syndrome is a value of 639.4. So all of the diagnoses that have that ICD code will then automatically be pulled up. And so I'll do add line. But what's important here is that I'm going to select or instead of and, because whereas with the panel we wanted to make sure that each of those checks and balances was there to narrow down the panel as much as possible and make sure it's accurate, here we want to pull from a variety of different places and make sure that all of the patients that have been listed maybe in different ways to have metabolic syndrome are going to be on this list. So then I'll go to problem, and so that was the description that I was explaining on the test patient window. It doesn't let me select that. Sorry about that. So problem, and I'll say contains. Here, the value will be metabolic syndrome. I'll add a line. And then I'll do that again with an or and a problem. And I've noticed that specifically for metabolic syndrome, there are two different ways that it's been described that patients in our clinic may have that diagnosis. It's either they're going to be listed as having metabolic syndrome, or they're going to be listed as having disorder of lipid metabolism. And in both of those instances, what the doctor meant when they entered it was that they had metabolic syndrome, but they might be entered in different ways. So in clinics, it's really important to make sure that there's a clear procedure for how the doctor does input that information and that everyone is aware of that, so that if you're the person developing this sort of a report, you can make sure that you're not leaving out a lot of patients just because it was labeled a little bit differently. And so then here, in order to make sure that I catch that other type, I'll say lipid metabolism. And then again, I can hit save, call this metabolic syndrome registry report, save, and now I'll be able to load and save this as well. So now we're going to select query, and it'll just take a little while for it to search all of the diagnoses. So we have 145 patients that, based on that query, have metabolic syndrome. And so next, what I'm going to do is select patient and search. I'll load the query that we developed earlier for Dr. Harvey, and select query. And so here we have all of the patients in the panel of Dr. Harvey, and here we have all of the patients in the clinic that have metabolic syndrome. And when I press complete, this is how many are of both. And I actually think I might have made a mistake because I think we should have more than 145. So I'm going to search, and if you don't mind, load this. Oh, that ended up with a little bit more. Sorry, I'm going to load this. And interesting. Okay. That's okay. So what it does is this is the number of patients that match both of these categories. And so it's important to press complete. And then if you want to develop a report based on that, then you can finally hit quick report. So are there any questions at this stage with how I developed that? Okay.
One comment I want to make, Elizabeth, I think if
Mm-hmm.
you understand how the clinicians are documenting, you can
Mm-hmm.
customize your search. So let's say you did have a clinician that was constantly misspelling metabolic. You would have
Mm-hmm.
to build the search to contain all the various ways that they misspelt it, and then you would
Exactly.
capture them in the search.
Yeah, exactly. And that's one thing that's important to think about if you're doing this type of reporting, is to really make sure that you're communicating with the doctors, that you're observing those sorts of mistakes, or not even necessarily mistakes, but I guess that you're catching the different ways in which those conditions might be documented, and making sure that as you go, you speak with physicians and everybody that works in a clinic to make sure that everyone's on the same page with the way that that documentation is going to take place. And then also being aware that with something like this in Telin, because you are able to save that sort of a search, if you had 10 different ways that people were documenting metabolic syndrome, it might be helpful to come up with something uniform for the future, but you would still be able to catch all of those patients that may have been described as having that diagnosis in the past with different spellings and whatnot, using this search function, because since you're able to save, it isn't so much extra work just to put in those 10 different versions.
Thanks. And thinking about this too, if a clinic were interested in quality control, depending on the type of searches that you were doing, you could find information that would be useful about how they are entering data. So, for example, let's say you wanted to find out how many patients were diabetic in the clinic, or possibly patients that have that are taking drugs for diabetes but actually don't have a diagnosis code in. So an example search would be to identify all patients taking metformin that do not have the diagnosis of diabetes. And once you have that report, you could go back in and make sure that they have diabetes listed as a problem in their chart.
Right, and I actually do have an example related to that. I'm just going to go to the search here and load, as you probably saw earlier, the metabolic syndrome registry that I usually work with. And you'll see I simplified it for the sake of our discussion earlier, but you'll see that I actually also included an accounts billing code. So that draws from, because there are 4 different places in Telin to put a billing code, and this, I took that from the accounts table, so you go to all tables and then accounts, if that makes sense, and the ICD code is listed down here, and you can individually select each. And so that was one of the ways that I could draw information from another part of Telin to make sure that I caught patients who were billed as having metabolic syndrome and at one time were said to have, but the doctor may not have actually put the diagnosis in. And that's something to be aware of. And of course, with metabolic syndrome, because it can change over time, this is a list of people that had ever had metabolic syndrome and may not necessarily be people that currently do. And that's something that I'm aware of when I work with my registry. But that's something that is important to keep in mind also.
So, for example,
actually, I'll show. Sorry.
So, just in that discussion, then. So, for example, if you wanted to pull up a list of patients that, and you wanted to exclude somebody that has moved on to the diagnosis of diabetes, you could accept them from your search. So, if they moved on and were given a diagnosis of diabetes, you could exclude them from your metabolic syndrome query.
Right. And you could, for example, I think the easiest way to do that would be to go to diagnosis and could say ICD, and I know that the ICD code, I should add. So add line and diagnosis, ICD code, and if it does not, ICD should not contain, and I know that the code there is 250, and notice that in this instance, I've selected and rather than or, because it's important that all patients that have diabetes shouldn't be on this list. So yes, that's an example of how I could do that.
Okay. Thanks. Let's see if you have any questions or comments maybe on how the approach at the 4th Street office that Elizabeth's taking, or other approaches that you've seen in your primary care network. If you'd like to comment now, be a good time to do that.
Hi, this is Syed.
Hi, Syed.
Elizabeth, this is really, fantastic to show all of these things. I'm a little bit more interested, like, for example, in our ASAP, we also want to track how many tests are offered. So, for example, if you are looking for a diabetic patient, so one way is basically we can go and check if we have any lab results. But if we don't have any lab results, it doesn't mean these, tests are not offered. Is there an easy way of finding how many tests are offered for any patient?
The first question...
You know what I mean?
Yeah, I know what you mean, Syed. But the first question I'd have for you is the clinic recording their offers in the POEM template?
I'm not sure exactly, because one of our clinic is basically using POEM. We have to investigate a little bit more, how they're recording things. But that's why I want to know, what's the easiest way? If they're using a POEM, if they're not using a POEM, how do we identify it?
So I don't specifically offhand know how you would develop that search, but from what I understand, if I close this and go to Query Builder, I know that Query Builder does allow you to do some more complicated searches like that, and for that, the strategy would be to begin by doing a search for all patients, and then you can use the search editor to narrow it down by the panel if you wanted. And so your first step would be in the patient window to do a search that way. And then secondly, you would go to diagnoses and use the search editor to pick your diagnosis. So pick the metabolic syndrome registry, and then you would say query in selection to make sure that it's only picking patients that you have picked for your panel in patients. I'll just stop this because we don't need to actually do that search, but you would do that, and then there's a way of then going to lab and searching using certain information about the last time labs were done. I don't know if it's possible to search for patients that have been offered certain labs, because I think that different clinics would record that in different ways. But I know that I wish this wasn't. Oh no, this is not a good time for Telin to freeze. But then I know that the next step would be to go to this lab window and then use the search editor, and again make sure that you query in selection, and you could search based on certain labs. So it's not a full answer, but hopefully that gives you a bit of a sense of where to go.
Yeah, thank you.
Yeah, and thanks for that question, Syed. I know the reporting from the POEM template is not seamless. It works very well if you are doing a chart review, that you can go to the POEM and find what information is there in the past to be able to determine if a patient was offered screening or not. And the reporting's not perfect from the POEM in Telin at this time.
Right.
Any other questions or comments at this time? Okay. Elizabeth, was there anything else you wanted to show today?
Yeah, it just occurred to me that there's one other thing that might be helpful, sort of related to what I was showing earlier. If we go back to Analyzer, I just want to show you another just a better example of how to use this complete function, because this is something that when I first started using this, it took me some work to make sure that I was getting exactly what I wanted. So I'll just show you an example of another diagnosis. So we'll go to diagnosis and search and load, and I'll show you we have a nicotine addiction registry. So I'll select that, and that's something that we've used in the past. It's another example. Select query, and it'll do a little bit of searching. But what I'm going to show here is how to make sure that I could pull the panel of all of the doctors in our clinic, and that just requires making sure that you use the correct set operation. So I just want to show you how to do that. While this loads, hopefully it'll load quickly. I do gather that depending on how many records are in the clinic, this can take a little bit longer, but it's not too bad. Okay, so this is the number that we have of patients that have these diagnostic codes that would be on our tobacco registry. And then I'll search patients and select search and load. I'll have my Dr. Harvey panel that we developed earlier, query. And so we can see that there are 516 patients right now. And then I'll go to patients again and search. And I'll select another doctor who's in our clinic, so Dr. McLean. And I'll select query. And so you see she has a few more patients that she has paneled right now. But then I'll change the set operation to OR here and press complete. And so I just wanted to show that so that if you do have a number of physicians in the clinic, you know that that's an option for you, that this will pull from. It doesn't require that they are a patient of both of these panels, because of course there won't be any patients like that. And this is a way of making sure that all of the patients that have this diagnosis are included, and then we narrow it down by each of these, and then we press complete, and we see that there are 82 patients there. So I just thought that that might be helpful, just to make sure that you didn't end up, when trying to press complete, that the set operation was always and you didn't want to run into any trouble there. So that's what I have prepared for this presentation. If you have any other questions, absolutely, I'd be happy to try and answer them.
One other comment, Elizabeth, as you're going along here, and I know we discussed this before, so when a clinic is in the panel identification process and building their panels, and we talked about creating a chart that you might use during the panel process to show a clinic that their panel is building, as the front staff are doing that confirmation and making sure that they are confirming the patient as a member of the physician's panel, that over time, as these numbers build, you can chart it and show the clinic what the progress is.
Yeah, absolutely. And so even just in the last few months that I've been working on this, I've seen this number grow by nearly 75 patients. And one of the things that I really like about Analyzer is how easily you can just run this search and immediately know. Today, Dr. Harvey has 516 patients on the panel, and even just yesterday he had 514, and you can really see that progress very easily. And so developing a chart that just shows maybe once a month or something what the numbers are like for each physician, and then making a simple graph of that can really be helpful to put in a clinic, because it can be such a collaborative process for different staff members contributing to confirming these patients, and that can be a really easy way of sort of making sure the morale is still high for all of that hard work, and seeing that every time you do click that button, it actually makes a difference.
That's great. Thanks, Elizabeth. If we don't have any other questions, we can conclude at this point. Any last questions for Elizabeth while she's on the line? Okay. Before we close off, Dennis and Syed, I want to mention that Elizabeth made a Word document, and it already is posted on the top website in the EMR Knowledge Resources area under Telin, and you can download that Word document that provides some instructions on how she is using the analyzer at her clinic. And it's also, Elizabeth, I believe, a document at your clinic as well that can act as a resource that if somebody else needed to step in and do this work, it would guide them on how to do that. So.
Yep, that's right.
Okay. Well, great. If there's nothing else, we will conclude. And Elizabeth, I cannot thank you enough. I like that you've shared your approach at your clinic, and other clinics can start adopting and understanding how to use not just the query tool, but the analyzer tool as well. So thanks so much.
You're welcome. Thank you for having me.
Yeah, thanks, Elizabeth and Barbara.
Okay, thanks, Syed. Have a good afternoon.
Yeah, bye-bye.